All right, welcome back, and we have another case that has been submitted to us. In this particular case, our patient is missing tooth number 4 and 5 in the upper right-hand side, and would like to have these replaced with dental implants. And the case was submitted to us by one of our workshop attendees, and I have done a quick workup on number 4 and number 5. Can we take a look? Any advice would be appreciated. Can this be done with 2 CEREC guides, or should I plan for 1 guide? Sorry for all the questions. There are not too many questions. Thank you. So thanks for submitting the case. And as always, step 1 is what type of guide workflow can we use here? And I'm going to say that this is a non-integratable tooth, and we'll call these non-integratable. So we have 1, 2, 3, 4, 5, 6 teeth that we can use to integrate our CEREC data. So to me, this is a digital workflow. Now, when we're missing 2 teeth, that automatically takes out CEREC Guide 2 as a singular option. So I look at OptiGuide as my choice there. Or if I were willing to mill 2 CEREC guides, then I could certainly use that. One of the things in determining whether I use 2 CEREC guides is the cost of milling. That's going to be $150. The cost of having a DigiGuide made in this particular case can be about $250, and the cost of a OptiGuide in this case can be about $400, all US. So that will make a decision on how you want to do it. What I also look at is 2 CEREC guides are going to be that I have to drill and take out the guide and put the other guide in and drill again. So in theory, it may take a little bit more time. And the other thing I use in determining whether or not I will use a CEREC guide is how tight the implant needs to be. When I have tight and need absolute precision, I'm always opting towards the OptiGuide in that case. So in this particular case, CEREC data was integrated. My only critique on the CEREC data is that one of the challenges we have here is that we only have essentially 1 tooth distal of our edentulous site, 1 tooth mesial, and maybe, because of the missing data here, maybe half a tooth. Okay, so we have like 1.5 here and 1 tooth here. This pushes the limits of a CEREC guide. I prefer to get my CEREC data. Personally, I prefer to get the CEREC data for the entire arch because then that gives me all my options available to me. And for CEREC Guide 2, I want to at least get half the arch through the second central or lateral incisor. I want to get that much data to be able to mill. So in this particular case, I would have asked or liked to have seen more data. Based on this data set that I have here, this, in my opinion, is pushing the limits in terms of what any type of guide that I would have fabricated here. So the next thing we're going to look at, and probably where I want to focus most of my attention, is on the guide design itself of the virtual wax-ups. I'm a big believer in spending a little bit more time in designing our teeth here. And one of the things I like to do is go through these mental exercises of where I look at my remaining tissue and say, based on that, where do I want my margins to be? Not just be, but where are they going to have to go? And when I draw a line straight across here, I can see that I want my margins to be like right there and probably right there. So that gives me an idea of what I want to do. And then the other thing I'll look at is I'll look at it from here in this view, and I can see that we have a little bit of tissue deficiency right here, but not so much up here. So this means that I can have good emergence profiles on this without having to do significant amount of work. So let's get everything back in there, and then now let's take a look at this. Okay, I don't have the benefit of the lower data here. It's available in the scan itself, but the scan is obviously the x-ray is taken with the teeth separated, but I don't have the ability to see the CEREC data for the lower arch. So I don't know how accurate some of this stuff is. So let me fix one thing here. I apologize. There we go. So our margins from this angle look pretty well drawn. Everything looks pretty good here. My bigger question in terms of this design itself is going to be when I take my down the view line. Now again, I don't have the lower teeth here, but what I'm seeing is I'm seeing my lingual cusp of my molar at this level, but then there's a drop down and my premolar lingual cusps are here. So my guess would be that maybe they should be designed up a little bit higher. Okay. The other thing that I notice as well here is when I'm looking at this. So here is my buccal contour there, my buccal contour there, but those premolars look like they're totally missing there. So I would like to see our premolars contours, maybe even the teeth moved a little bit buccally, but definitely brought out buccally. And the other thing that I see is right in this area right here, we're definitely deficient in our design of our virtual wax up teeth. And I'd like to see that a little bit more ideal there as well. So again, I know that's nitpicking a little bit, but we have the technology. We want to have ideal restorations. And the reason that I'm being a little bit more particular about that here is based on our design that we have. You know, our emergence, you know, I don't know how realistic some of this is. You know, and right here our implant is coming out the incline of that buccal cusp. So I'd like to see that a little bit better. And a lot of that may change. Like for example, you know, I really doubt our tooth is going to come out with such an angle, with such an angle like this. To me, the tooth would probably be, number one, I want it designed out a little bit. So it would probably look a little bit more like that. Okay. Like so. I apologize. I had to go do a couple of hygiene checks and go see a patient, and I came back. I forgot I was doing this video. So, anyway, let's kind of get back to where we're at. So, you know, again, those are some of the concerns I have there. So, ultimately, what I would like to do in this particular situation, and here also you can see again, you know, I just don't love. You know, this is what I'm guessing my emergence should look like. And I just don't love that part right there. So what I would want to do here is I would probably twist my implant a little bit that way. So let me show you here again. So we can see our implants coming out right in here. So what that would do is a couple of things. One is it would get me back to being a little bit closer to the center, just like so. And then what it'll also do is, you know, it'll give me a little bit better emergence right here as well, just like so. Okay, so that'll be nice there. And then, you know, once I have that in place, get my mesial distal positioning a little bit better there. So something along the lines of that right there. Okay. So now we can see we're pretty well centered there. And now what I would do here is try to go ahead and make number 4 parallel to number 5. And we can see that we can get that done. And then, so that gives me my you know, my straight up and down positioning so that I'm coming up and down. And then in this particular case, what I would do here is just like so, and get my implant in a better position there. And now we can see that we're going to be more parallel, a little bit better centered, and now we're going to be looking at a good option for screw retained restorations. So this is kind of some of the minor changes I would make on this. So just to give you an idea here, let's take a peek here. So we can see how that's not quite as parallel as I would like it, but then again, it's definitely compared to here, we're definitely looking much better there. So hopefully this makes sense. Back to, in terms of the guide, again, I would personally go for an Opti guide here. It's easier, it's faster, and that's honestly what I'm more into, is making sure that everything's a little bit easier and faster and more predictable. And so that's kind of my thought process here. So thank you for submitting the video.